Welcome everyone to the JustCovid meeting. That's our second regional meeting. And the purpose of our meeting is to discuss how the penitentiary system reacted to the COVID-19 pandemic, what problems emerged and what are the ways of solving them. My name is Marina, and today at our online desk, so to say, we have representatives of Georgia, Armenia, Moldova, and Ukraine. First of all, I would like to give the floor to our colleague from Armenia, Hasmik Harutyunyan, who is working in this field for several years now, and she works precisely in the organization which monitors prisons. Could you please tell us about the problems that your organization encountered when monitoring prisons, and whether you had to develop some new methods or algorithms of working in the situation? And could you please tell us about your general impressions in the first months of the pandemic? How did it change your working schedule?
In Armenia, we have this prison monitoring group. We have also the MPM mechanism under the OPCAT possibility. The monitoring group is composed of several NGOs and its members, which have unrestricted opportunity to conduct visits to prisons without any restrictions of time and hours, irrespective it's weekend or working day. Of course, after the COVID pandemic and after the declaration of the emergency situation since March 2020 in Armenia, all the institutions and their functionings in Armenia have been changed, including the activities of prison monitoring group. As such, we have faced many problems, even risks, how to continue our normal visits, how to conduct our regular visits to prisons, because the time, the format of the meetings, the format of the interviews with inmates in their cells or in different rooms has been changed, which required also the change of our work and activities. For that purpose, first of all, we organized a special training session for the group and group members, covering all the issues in regards to the COVID-19, what kind of risks there are, what is required in terms of sanitary requirements to conduct the visits. We have obtain special equipment, uniforms, gloves, all the necessary stuff to conduct our visits, which decrease the risks of the pandemic and the spread of the virus. Hopefully, since March, we were able to conduct our urgent visits, but unfortunately, our regular visits, for example, if before pandemic, we were able to conduct 2, 3, or even 4 visits in a week. In the beginning of the pandemic, we were restricted to conduct only urgent visits based on urgent alerts. If before we didn't have any restrictions, how many hours we can stay, with how many inmates we can conduct interviews, now we are restricted in terms of the format. In what format we conduct our interviews and our meetings, because we prefer and we are obliged not to stay in the cells and in the prison in general more than 2 hours. Even if we stay, we change the masks, gloves, everything, all the stuff a couple of times, and this is not only this is being done on the one hand to prevent the spread of the virus from us, but also to prevent the circulation if there are such risks in the prison, because as such there were no restrictions to enter to the prison, not only for the group members, but also for the advocates in the Republic of Armenia. But there were and still there are special requirements in regards to the uniforms, using all the sanitary requirements, etc., which of course creates some obstacles obstacles requires change of the activities of normal functioning, but hopefully I can say that so far until now no major omissions or major obstacles were created to hinder the overall activities of the group. But of course, the number of the visits has been decreased since March 2020.
Tell me, please, you mentioned that the format of the interview had to be changed. What did you mean by that?
The group usually functions based on specially prepared questionnaires and tools, which covers everything. The conditions of the cells, sanitary conditions, all the issues in regards to the prison conditions and the punishment that which is related to the inmates. At this moment, and since March, the use of the questionnaires and the use of the tools has been changed, because now we are dedicating more time and emphasis to the sanitary issues, both in relation to the inmates and prison staff. What kind of measures have been taken in terms of sanitary requirements, how the health issues coming from health problems coming from prisoners are being solved, in what terms the isolation and other issues are being organized by prison administration and prison hospitals.
Now I would like to give the floor to our Georgian colleague, Mr. Akaki Kukhaleishvili. He is vice head of the National Prevention Mechanism in Georgia. So, Akaki, could you please tell us, in the way Hasmik did, how you adapted, what you had to change, how you had to change? So what are your new work algorithms and what are the problems that you encountered?
I would like to thank you once again for organizing such an interesting event. So I think that our mission, National Preventive Mechanism, the mandate that the Public Defender Office of Georgia has started since 2009. And our group monitoring team is on the monitoring mission right now. And I would like to use this opportunity and thank OSGF for support. This case of COVID-19 was reported in Georgia. So at the first period, we had to seize we had to stop all the visits, all the planned visits to closed institutions. However, during this period, representatives of the Criminal Justice Department continued to undertake individual visits with all the precautionary measures in place by strictly following the do no harm principle and trying to conduct individual visits. And it provided us with certain opportunities for preventive engagement, as was an important source for our information. We used this small period for mobilizing, and we started adapting our methodologies to current challenges linked with this COVID-19 pandemic. To protect both monitors and people in closed institutions, of course. So the members of the team are obliged to follow the rules. Of course, the rules are governed by World Health Organization recommendations and by the recommendations of our government. It is very important for us that the rules include 3 levels of security, from the low security, medium security, and the high security. So the members of the special preventive group have to wear special individual protective equipment during the visits, such as masks, gloves, some medical eye protection equipments. So it is very important that relevant security levels are applied to the subsequent monitoring objects. So at least medium protection measures must be observed when visiting closed institutions. Also, one of the important components is that we have to measure temperature before visit, and if the monitor has a temperature from 37, she is obliged to cease the visit. Of course, instructions are very detailed and clear, and it is very important to follow. we had to continue our monitoring visits, and it was the recommendation of SPT as well to continue it. And from April 30, we started our monitoring visits in all institutions. So to give you the clear, to give you some numbers, since April, MPM conducted 2 visits to the migration center, 28 visits to 33 temporary detention isolators across the country, 34 police stations, 5 visits in 4 mental health care institutions, 17 visits to 6 penitentiary establishments. Furthermore, we had meetings with lawyers and students in 6 regions. On top of that, we had a dialogue with the Immigration Center on the implementation of our recommendations. One of our core recommendations were having a COVID-19 prevention plan. So we agreed with them that they had to elaborate the plan and follow concrete safety regulations. On March 21, Georgia declared the state of emergency and imposed restrictions on several human rights, including the right to liberty and freedom of movement. So we had special regime such as quarantine places, and person who was in contact with a person with COVID-19 had to go to the isolation for the deprivation of liberty. So we started monitoring these places as well. So it was very important for us. It was a new type of institution. Like in Georgia, quarantine places are organized in hotels. So we had to monitor by different technical for visitors, long-term visits, family visits. Prisoners were isolated from other prisoners. The contact with outside world was also suspended. Of course, there were kind of compensation was granted in terms of raising giving some more free phone calls and giving some additional opportunities. But still, it was a difficult time for them, prisons, to avoid this spread of virus. So we continue to monitor police stations. The TDIs we monitor as much strong safety measures as we had in penitentiary establishments. So they had to. We had a lot of recommendations, and the institutionalization of the system was also one of them. So we had to. We had a lot of challenges in terms of conducting. We had to conduct very short monitoring visits because you know that it is not so easy to wear this protective equipment and to have these long-term visits there for more than 4 or 5 hours. Also, at the first time we had to phones, like we went to the two penitentiary establishments and had to communicate with of course distances, and everything went smoothly after this. I can say. So these are the issues that, but still we think that if we have the protective measures, if we follow safety rules, monitoring missions are possible, and we will have our reports at the end of the year. Thank you.
Thank you, Akaki. I have 2 questions. Hasmik, for example, mentioned that they had to adapt their interview format and the subject of the interviews as well towards the topic of health of the prisoners. Did you have to change the format of your interviews? You mentioned using phones for your monitoring visits, but okay, did you have to change the subject of the interviews? Did you discuss health more, or maybe you didn't? And another question regarding transfer of prisoners. So if there was no chance to host all of the prisoners in a way that would not violate the rules, so how exactly was the transfer problem solved? Who was transferred? Who was informed about the transfer? How were the family members informed? And who and how took the decision? Who made the decision to transfer them?
I said that staff was accommodated inside the prisons, so they didn't leave the premises. for a certain period of time. Now it's changed, and they have they live they are inside prisons for 2 weeks. After they change, they have the tests. They make tests, and then they the premises for 2 weeks, and then they return. But before, all of them had to be accommodated inside the prisons, and it was difficult because imagine for 2-3 months being inside the prison, being accommodated there. It's so difficult for them as well. As for the health measures and the epidemiological situation, this was one of the main concerns of our monitoring visits, of course, and we checked whether the establishments were prepared for the situation, and whether they had the crisis plans, whether they had special safety regulations, and whether they had some trainings about this. And also, like, the first was checking the epidemiological situation and their readiness for this, and the second was the impact of the measures on prisoners' rights. So the two aspects were examined there. As for yes, these were the issues. And as for the other questions, well, can you please remind me the another? Yes, like interviews, phone interviews. I have to mention that like the only one monitor, we had only one monitoring that we use these phones. Like it's inside prisons, and you call them like when it's a short-term visit for prisoners. But otherwise, we had these face-to-face interviews with all protective measures in place. So this was only once. Other 17 visits were all like face-to-face interviews and normal interviews, I can tell you. But the only exception was that we had these short monitoring visits, like 3 hours, 4 hours per day, not like 7 and 8 hours. So of course the interviews also were short, and this methodology was also in place.
And now I would like to switch to Mr. Alexander Zubko. He is our colleague from Moldova. He works on torture prevention with the apparatus of the National Advocate of Moldova. Could you please react to what they said and tell us about how the situation in Moldova is different from ours? The first 4 months, no visits were conducted at all to any institution. The first visits were resumed in June. So far, a total of 23 visits has been conducted, mostly to the penitentiary facilities. Of course, the problems which existed and still exist in penitentiary institutions, they have not really changed after the pandemic. So the old problems still exist, but now we have some new problems. Our prisons are overcrowded, and this overcrowding hasn't gone anywhere. And due to COVID-19, this overcrowding is becoming more dangerous. So our authorities have arrived to a decision, basically to limit jail time for suspects to 7 days. So basically, but the suspects are kept in prisons to make sure that there is no cross-infection. So the main problem is still overcrowding, just as it was before the pandemic. So obviously crime didn't go anywhere because of the virus, but now the suspects are taken to jail, not to temporary detention facilities, but directly to prisons. But the term for temporary detention has been limited. As for our methodology, which are set by the National Monitoring Commission, so we should use gloves and masks during our visits, and visits should be short, no more than 2 hours. We try to maintain the distance, but in penitentiaries of Moldova, it is a bit hard to maintain because, you know, our prisons are still Soviet style. We have bunk beds, and each cell houses many inmates. So those inmates who want to testify, who want to provide some evidence maybe, they approach the cell door and we talk through the window. We did not alter our methodology much our staff has questionnaires which they fill out regarding violations or non-violations. This basically it. We don't have a problem with questionnaires or changing our questionnaires. It is strange in perspective, I know, but we did not notice anything out of the ordinary that was not there before the pandemic. So we did not get many complaints from the inmates. In June, we made our first monthly report on the COVID situation in penitentiary facilities. Well, the first 4 months, it says a lot that in the first 4 months we didn't have a single case of COVID-19 in our prisons. But on the other hand, over 50 prison staff got the virus. And these cases were confined to 2 particular prisons. So inmates did not get infected, but prison staff did. There were 2 sources of infection, and they were discovered in September and suppressed. There are still no cases of infection among the inmates, but prison staff, there have been almost 80 cases of infection among prison staff, and there has been 1 death due to this. The main problem today is that inmates are asking for contact with relatives. During your visits, have you noticed prison staff or inmates equipped with masks, gloves, soap? So have you noticed the common medical recommendations being extended to both the staff and the inmates? As for the safety measures, there were none. Each staff member bought his own mask and used it. If he had a temperature, if he had a fever above 37 degrees, he was not allowed into his workplace. As for inmates being, as for masks and gloves being distributed to inmates, well, the first cases of this appeared in June, but these were not paid from the state budget. These were mostly gifts. So it was basically humanitarian aid to inmates. Thank you, Alexander. And now I would like for us to switch to our representative from Ukraine, Mr. Konstantin Avtukhov, the manager of an NGO called Ukraine Without Torture. Could you please tell us about the situation in Ukraine and how it changed with the pandemic? As for our own story, our own little COVID story, well, the first 2 or 3 couple weeks were without a harsh lockdown, but in March, of course, we went into total, absolute quarantine. Now, how did this influence us? Of course, it did. Our monitoring, however, was not interrupted. We had a couple of weeks when the visits were not as frequent, but we resumed them very quickly. Of course, with a lot of limitations that were not there previously. And these limitations were mostly pertaining to safety measures. In particular, we used the Rebirth Fund to purchase protection measures for our monitors. Monitors of our national prevention mechanism provided their own protection measures. On one hand, it was difficult, it was bad, because monitors were afraid and they were not as efficient as we expected to be, but it can be understood, it can be understandable because no one really knew what to do. NPM was reorientated towards, instead of fighting torture, towards monitoring the rights of inmates and prison staff to proper protection. So the time that we spent on monitoring torture and human rights violations, we started spending this time on things we deemed necessary in the epidemic situation, such as disinfection barriers, masks, gloves, everyone having these gloves, everyone having masks, and necessary equipment everywhere. So we started disregarding torture and human rights violations. There was a case in a temporary detention facility in Chernovetsk when a suspect was brought from there with a COVID-19 infection. And the other suspects, they actually barricaded themselves inside their cells, and they demanded not to be seated, not to be put in a single cell with this infected individual. So basically, there was a rebellion from inside the jail. They demanded to uphold the security measures when it came to the pandemic. Now, what happened later? I can say that there was a growing rehabilitation. There were visits, of course, but these visits, well, half of the time of these visits was devoted to putting on masks, putting on gloves, using disinfection methods, using hand sanitizer. So sometimes there are problems like, for example, the penitentiary facility paid for security and safety measures, but the supply was late. But then we come with a monitoring mission and ask them, where are your security measures? So, but we understood, we had a degree of understanding with them because we realized with the difficulty, and we realized what it took to obtain the security measures. After a couple of weeks of harsh quarantine, we were still denied entry. So we limited ourselves to monitoring hypothetical sources of COVID infection in penitentiary facilities, such as the transfer points. So basically, a volunteer would come, look around, see if there were checkpoints, see if there were thermometers, see if there were masks and gloves and so on, and then he would report on it and go back. But there was a degree of solidarity, however, and the prison administrations tried to do whatever they could. They tried to meet us halfway, so to say. So we did not encounter any like harsh denial or harsh declining. There are still some painful moments here and there. And the most painful point is, of course, the problem of medical assistance for the inmates, because due to total lockdown, it's really hard to move prisoners for medical needs and to have them studied in civil hospitals. This is very difficult these days. There are issues with prison transfers. So for several months now, prison transfer between prisons has been suspended. Some of our prisons are located thousands of kilometers apart from each other. And then there is also the issue of other diseases, such as tuberculosis. So for example, we have a tuberculosis patient who needs to be transferred to a hospital, but he can't be transferred because of COVID-19 fears. And we were worried about prison rebellions and prison riots. Another problem is prison visitation. Initially, inmates could only communicate with lawyers and only by phone. Then we started doing short visits. So now we have non-contact visits from family members and short visits for lawyers, family members. Some of the prisons have purchased tablets, and these tablets are used for digital distant communication. We have a small problem with no measures being taken to release the inmates. We also had a big problem with transporting inmates. Our country is huge, and we have sometimes a prisoner has to be transported between their homes or where they were caught and the prison. And in the conditions of total lockdown, it was difficult to transfer them. So once again, NGOs tried to solve this problem together with the government. Now I have a question to Hasmik and Akaki. Which main violations of human rights you noticed during your visits during the pandemic? And I also have another question. The recommendations that you gave to prison administrations regarding what they have to change. After you came back to these prisons for a second time, did you notice that the prison administration followed these recommendations? Where your recommendations followed?
In the beginning, just after the declaration of the emergency situation in Armenia in March, there were special clauses also requiring that the family visits, sending persons to prisons is being prohibited. So the visits for long term and short term for prisoners with their families, relatives, friends were forbidden. This was a serious concern for the prisoners in the beginning, but of course they themselves and we as observers and as human rights activists, we understand and understood that this was a requirement and preventive measure to restrict and decrease the risk of the spread of virus. The declaration of emergency situation in Armenia, prisoners may have visits and meetings with their family members, relatives, etc. But the visitors have to undergo the testing to be sure that there is no risk to bring the virus to the prison. But of course, still the number of visits in terms of the respect of their private and family life is very low, which is not good. And this may be described as some restriction in terms of their human rights. Another issue which is much more problematic and concerning is the continuation and of the rehabilitative programs in prisons, because the majority of existing programs in prisons related to their social reintegration has been suspended. Of course, this also may be understood, but the time passes and the prisoners who undergo punishment in prisons and penitentiary system have to do something, have to undergo some programs during this time, during this period, both educational, cultural, etc., etc. But still, there are problems in this regard, and we hope that by time, when the situation is more stable, this issue may be resolved. In summer, some of educational programs have been pandemic as well. Still, we see this is the quick and quick response to all the health problems that inmates, prisoners face in the prisons, because in terms of medical support in Armenia, in our penitentiary system, there has always been a problem, and still at this moment as well, we see that this issue is not being solved until now. What can be done to decrease the number of prisoners in prison system? As such, we presented some regulations how to apply the early conditional release system in Armenia, to calculate how many, to provide statistics, how many prisoners with serious illnesses we have, elderly prisoners we have, and what can be done to in order to change their punishment and the imprisonment. The approach of the Ministry of Justice in cooperation with the prosecution was good enough, because a lot of prisoners and their pre-trial detention has been changed, not related to the imprisonment. But when it comes to systemic changes in terms of sanitary requirements in all the 12 prisons in Armenia, whether all the prison administration is wearing special masks, gloves, whether all of them are being equipped, all the prisons equipped with these alcohol gels, etc., etc. After each visit, we have noticed that totally there is another, it's not good. Maybe one prison has more resources, that's why it's the requirements are being kept, but overall there was not the penitentiary system, but also the overall country was not ready maybe to such a challenge, but hopefully they are doing
previously they still remain, plus we have problems in terms of this epidemiological situation in Georgia. So what we have now is that on the one hand we have this lockdown and we have actually penitentiary system managed to stop the COVID-19 spreading COVID-19 in prisons. However, it's debatable whether the measures were adequate and whether they were in conformity with human rights, whether these measures were necessary and adequate. So we were assessing these components as well. Hours without any activities, and of course this worsens their situation, and this can provoke violence in prisons, and maybe for a certain period of time it was somehow manageable, but we can see in a long-term perspective that it can create violence, it can be a threat in terms of treating the prisoners. And also when we are speaking about the prison staff, on the one hand we are preventing this virus by locking this prison staff there, but we have to think about their situation as well. It's very important that these people should also have actually they had problems with the contact with their families, because when they were inside prisons they couldn't use their phones, so they had to leave their mobile phones outside, and then they had to go to the director and ask the director to allow them to call the family members. So the psychological situation of this staff is also very important here. So what were our major recommendations? We were telling them it's very important to have a concrete action plan. What you are doing in order to, on the one hand, to have these measures, but on the other hand, you have to compensate. You have to change. For instance, if you have banned family visits, you can remedy by other means, such as, for instance, it could be some Skype communication or other technical ways. So it was not done, and it created a lot of problems, and we are sure that it will create more in the future. As for other problems, I could mention overcrowding. We have this problem in Georgia as well. The incarceration rate in Georgia is very high. In Europe, I can tell you, and nothing was done for making the probation system work effectively. Some changes were made, but it's not enough for the country like Georgia and the population we have. We have a very big prison population, and also one of the major problems that we have in terms of violence and prevention of torture and human degrading treatment is criminal subculture, and it's like the phenomena which needs a special approach. And so the problems that we have are the same, I can summarize, and plus we have this very difficult epidemiological situation. As for the dialogue and as for our cooperation with the authorities, I can tell you that unfortunately the Ministry of Justice is not so cooperative. We have a better cooperation with the Ministry of Internal Affairs. I mentioned the Migration Center. We had meeting with the representatives of the Migration Center. They were supportive, and they were trying to implement our recommendations. And we had a very interesting, constructive dialogue with them. and they implemented some of the very important recommendations. For example, like one of our recommendations was to have the safety rules, to make the rules, and to train all the staff members about the safety regulations. And we had the answers from them, and they said that they implemented this recommendation. So this is what I can say about our situation in Georgia, briefly.
Have there been attempts from the state or from the other institutions which are involved with the penitentiary system to reduce the number of inmates which are currently in prison, or maybe to reduce the number of arrests, the number of suspects in temporary detention facilities?
What kind of measures have been taken in this regard? Just in the beginning of the emergency situation, there were discussions and talks about whether we need amnesty or not, because in Armenia we had the last amnesty that we had was 2 years ago in 2018, and hopefully, fortunately, now and after this 2018, we don't have any problems related to the overcrowding, although in some prisons in cells level there may be some overcrowding issue, but not overall overcrowding in the system, in the penitentiary system. There was no amnesty after the pandemic in the Republic of Armenia, but there were some steps taken by prosecution and the Ministry of Justice just to change the pretrial detention with other measures not related to the imprisonment. In the beginning, this was effectively working, and I want to highlight as well that there was a good tendency also coming from judges who themselves applied the standards in their decisions presented by the CPT. That was a welcoming approach by some judges, although not systemic, but some judges, they themselves started using other pre-trial measures, not related to the imprisonment. But this was in the beginning, after the situation was like before the pandemic.
In order to reduce the prison population, I can tell you that certain steps have been taken for reducing some population by intensifying the existing systems that we have. One of the systems is the early conditional release system. So we have the special local councils of the Special Penitentiary Service, which examines cases. Last time they examined like 1,000 cases and approved 300 cases, something like this. But still it's not enough, because we have interviews with prisoners and they say that it's something that that needs to be changed, and they have to intensify their work. Of course, we see that there are different problems connected with this. For instance, like for this local councils, the staff, they need more staff to consider more cases and all other issues, but still it's not working very well. So and a lot of problems are linked with this. All these issues of overcrowding, rehabilitation, contact with the outside world, everything is interlinked, interconnected. So that's why I think that, and our assessment of this is that it's not adequate and it's very minimal. So they should intensify the work in terms of this.
In spring, we offered the Ministry of Justice to release some of the suspects due to the pandemic. We got the answer several months later. It was a refusal. They refused because apparently their early release of these suspects will lead to disruption of public order. But we protested, of course, but this remained as such. So, for example, there was a bill on amnesty discussed in the parliament. We supported this bill, but this bill was turned down in the parliament, and it's still being kept in the custody of some minister or secretary. So everything was left down to the Ministry of Justice. Basically, the Ministry of Justice said it's not going to release people prematurely. As for preventive measures, we have, of course, created a list of measures that can be taken instead of the currently existing ones. But each of our prosecutor's office has a degree of independence, and therefore it's free to react in any way it deems fit. It can respond to our recommendations, it might not respond to recommendations. So some of the people actually who were released on parole, they were called back to prison, and we got even more overcrowding. And judges also are very scant with liberation, with mild sentences and so on. This is a very rare occurrence in our system. So, well, this is it. This is my personal observation. It might be wrong, but for me, this pandemic has shown that we have good people and a bad state, because at a regional level, we had consensus, we had appeals, we had meetings where the regional judges were recommended not to detain people as much. So we had a lot of horizontal work, but very little vertical work, so to say. There were very few centralized solutions. There was really very little centralized consensus. So on one hand, we have pride that we can deal with some problem at a regional level, but on the other hand, we have apathy, because this is not being done on a central level. This is not being done as part of a state program, as part of some measured decisions. So we have to basically work between the lines, which we don't like at all. We also have very different practices when it comes to problem solving in various regions. If you have any remarks regarding what you heard today, if you have any recommendations to how to solve the problem in light of the upcoming first wave or the ongoing second wave, so please share your comments, share your insights before we finish.
Thank you for all the information and for organizing such an important discussion workshop, I can say, because all the experiences, views, and opinions shared are very important for our further and future activities as well. I can say only that it's not only the efforts and the functions done outside of the prison system, such as different NGOs, different oversight organizations, but the prison staff and the prison administration themselves, they should understand that wearing the mask, wearing gloves, and using all these sanitary requirements is the first prerequisite to prevent the spread of the pandemic, to prevent the risks. At the same time, we should be able to continue our activities, if not the overall general activities and functioning that we used to have before the pandemic, but somehow to organize in a way that allows us to do all the activities and functions deriving from our mandate. Otherwise, we cannot wait or suspend everything and wait until the pandemic is over, because we ourselves, with our actions, effective actions, should do everything to come to the end earlier, without any major losses and without any hindering of the human rights protection, not only in the penitentiary system, but overall in the general society. Thank you very much.
COVID-19 pandemic made us modify our traditional ways of monitoring, which is a challenge itself. So these public-related measures limited our capabilities in relation to the duration of visits, number of prisoners interviewed, the possibility of interviewing the prisoners like we did previously. And also there are the safety measures, the physical distancing, which are important issues. So as it was issued by international organizations such as SPT, CPT, they recommended that our visit should continue, and it is very important because when we are speaking about restrictions, when we are speaking about different measures, special regimes, it is very important to analyze our role and see that our preventive mandate is very important in this situation, especially in closed institutions where we have vulnerable groups, and leaving them behind is very problematic. So I think that with all the regulations, with all the safety measures, we can continue our monitoring and try to do as much as possible in order to prevent torture and human and degrading treatment. Thank you very much.
Well, we have a similar problem in the penitentiary system in the Ministry of Justice of the countries. But I think our situation is the closest with that of Armenia and Georgia. Unfortunately, we are going to have to adapt alongside the state because the state is a slow thing. It is slow to react. But I hope that eventually we're going to arrive to the solution of this problem, which, of course, is necessary for our small countries. Thank you. I would also like to thank all of our speakers. Thank you for agreeing to participate in this online discussion. Thanks for sharing your decisions. Thank you for sharing your solutions. And thank you for showing so much solidarity. And thanks to all of our audience and who are listening to us. And maybe if you have any solutions to our problems discussed here, please don't hesitate to share them online. Thank you and goodbye.